Eleanor Slater Hospital, 2 questions. Come Friday night, you made a decision that unvaccinated workers could continue working there or they would have faced a severe shortage. The immediate reaction was, why is what's good for thee not good for me? And that was one of the quotes. So number 1 question, what is your response to the nursing homes and other groups that say they are suffering with their own severe shortages and turning back people who might come in? And number 2, can you give us an update? Are there any replacement workers yet? Have you sent in the National Guard? Where are we on your efforts to try to replace the unvaccinated workers?
Well, first, I really want to thank all the healthcare workers who got vaccinated. They have made the state a great deal safer. I am disappointed that our staff at the Eleanor Slater have not been vaccinated. I think we know that there's good reasons to do it. So what I would just say is, look, when you're faced with that, there's no real decision to make. It's a fairly easy decision to make, right? Either you're going to do everything you can to keep the patients safe that are in the hospital. I think I've made that a top priority in our conversations about Eleanor Slater, and you've reported many of those stories that the patient's safety was a top priority. So you can't keep them safe without staff. So we were, that was a decision that I made with Rick Charest and the Department of Health. I think that the Department of Health did their very best to get everybody vaccinated. But in this case, the choice of having personnel in there to take care of the people that are there, it rose to an emergency situation that I felt as though that it was important to make sure the staffing was there. To the people who are, they're asking the question in terms of, we're operating in a way that is difficult for us. It's difficult for everywhere in this issue. But I would also remind the operators of the nursing homes as well as the hospitals as they came to me and asked for this mandate. And I agreed that it was a mandate that was appropriate to put in place. I've been very reluctant on mandates, but in this case, with the hospitals and the nursing homes asking for that mandate, I felt as though that was important to keep the people safe. We'll work through, if anyone's having an individual issue right now, I certainly will open to listening to them and asking where they are, because again, we need to get people back into the workforce. But in this case, the vaccinations was a request that came from the hospitals as well as the nursing homes, and we'll continue to work with the hospital leadership and the nursing home leaderships if in fact they're facing what they would consider an emergency situation that we had to address at Eleanor Slater.
And at Eleanor Slater, what is the current situation?
Yes.
Any replacement workers, National Guard, any other steps taken?
Yeah, so I had another conversation with General Callahan yesterday about potentially National Guard. The issue there is that they need which is, again, a distinction between us and the hospitals, the psychiatric skill sets that need to be had in Eleanor Slater are specialized. Right now, the National Guard does not have access to that core skill set. They are prepared to to help us if there is a reason for them to have a presence. Contracts were signed, and this is not the best case scenario, but it's one that we were willing to go down with traveling nurses through a consultant group that was signed on October 1st. They were indicated they would be delivering by October 15th. They haven't got there yet. My understanding is that they had committed 6 personnel that come in on Wednesday. That's tomorrow. I believe that only 3 are coming in tomorrow. So it's an illustration that it's a it's a difficult task, and we're making the best of making sure that the patients are safe. That's my top priority right now.
Thank you. Bill?
Governor, a 2-part question. Are there any other groups, industry groups, whatever, that have approached you about a similar vaccine mandate as healthcare industry?
No, I don't. I think that we have done very well without the mandates. I would speak to the issue that's being talked about right now with personnel with 100 or more potentially having some form of a mandate. It seems as though that and we're going to communicate this to to Washington, to D.C. through our congressional leadership. States that are at 90% of their population vaccinated with lowest death rates, lowest hospitalization rates, we know that mandates are difficult because you're never going to get 100%, right? You're not going to get 100%. So we're, I think, at 97% of the healthcare workers, and yet there's, and they have the right to demonstrate. They have the right to go to my house. I would ask them to be a little more polite to the neighbors next time they show up, if they do show up. But so you're never going to get 100%. So it's going to be disruptive. So it seems as though that states should be able to, in those cases, and other states have, they should be able to say, all right, we want to have a vaccination protocol, but there's also a way to use testing and masking in a way that can, that can address the fact that there's a certain percentage that are not going to get vaccinated. Our economy depends, as I started the whole first presentation, our economy depends on people working. And anything that we do that potentially would take people out of the workforce, unless it met the standard of the health care, which I agreed with, we need to be careful about.
Yeah, so just a few hours ago, John Hazen-White Jr., Takeo Comfort Solutions, you're at the Dunk, and he said, look, I'm not in favor of these mandates in terms of 100 or more companies with 100 or more persons requiring a mandate. Have other business leaders in the state approached you in a formal or informal way advocating for you to go to Washington and try to basically push back against that notion?
So I think that, I can't remember what was late in the day yesterday that I had read that something's coming before the end of the week. So we haven't heard from many of the businesses, but I think John Hazen-White, I agreed with him that if you're in a state, again, that is second in the country, when we were last in the country, when, in March, on vaccination rates, and safety protocols are being followed, I think there's, losing employment right now is not a good thing for the state of Rhode Island. We're actually, as I said in my opening comments, we're strategizing how to listen to the people who are on the sidelines treading water to actually get them back into the workforce. So I think states, we're not the state that's got 50% vaccination rates or with hospitalization rates that went through the roof during the Delta. We're a state that we should be able to take advantage of all the efforts that the people in the state of Rhode Island put in to get us vaccinated, whether it was Department of Health, whether it was National Guard, whether it was our local leaders, whether it was our firefighters or our local nurses, FEMA, REMA. I mean, we should be able to take advantage of that. So I'm going to make it known that I think that there should be some strategy that allows states that are in certain positions, as we are, to have some flexibility and potentially either in testing or in in masking type of protocols that we can put in place. We're just finishing the first week of test to stay in Westerly. My understanding is that there are processes there that we can keep people aware of the need to stay safe, but at the same time keep our economy growing.
Governor, the K-12 Council tonight is voting on whether to renew Commissioner Infante Green's contract. I believe she's not up until April. Is this something that you requested?
So I think I was very public. I think I was asked this a few months back. I was looking forward to working with the commissioner. I think that she's the right person at the right time in terms of for the whole state. Working very closely with the commissioner in Providence. I've certainly have had something to do with the state contract being, the Providence contract being settled, as well as the superintendent that's sitting in the superintendent's office right now. I'm certainly involved in that. So just cut off a call. We have a bi-weekly, two calls a week with the commissioner on education issues throughout the state. Was in Woonsocket today, as many of you were there, talking about a recovery strategy for, for the school districts that were most highly impacted by the COVID. So yes. We've made it very clear that we're looking forward to having the commission enter into negotiations with the commissioner with the thought of extending that agreement.
So you're sort of trying to lock her down before she gets scooped up by someone else, or what's the strategy to do it this a little bit early?
No, I don't think it's too early. I think that it indicates that there's certainly a vote of confidence as a governor, sitting in the seat for about 8 months. I do know a little bit about education. Clearly, we'd like to outline that at some point, and I think that we're getting close to really putting out an education policy statement out of our office that reflects that. So, no, I think that what it reflects is that I think the commissioner is very much dedicated to the work in the state of Rhode Island, and those are the type of people that I want to work with.
Governor, you talked quite a lot about the program to bring people back into the labor force, and we have Director Weldon and Secretary Pryor in the room with us. But do you think that there are more substantial systemic obstacles to reintegrating people into the labor force? For example, there's an emerging national consensus among economists, and this is not just Rhode Island, that the recovery is split or bifurcated, that people who are in a situation where they can work from home and have stock market investments are doing very well, and other people who are in essentially minimum wage or unskilled jobs or who have to physically go out there are doing very badly in the economy. And that creeping increase in inequality is itself a problem for the economy, but that there are systemic obstacles there. For example, the rate of participation in the labor force for women is recovering much more slowly than for men because of child care problems, that the society doesn't provide child care options, or at least not economical ones. And so is there a problem on the other side that, we're giving some aid here from federal money to small businesses to try to bring employees back, but what are we going to do about the systemic obstacles that the employees themselves face, that we see on social media all the time, that employees are asking or applying for jobs 30 and 40 times and they're getting no responses? So is it really a correct sort of narrative that the problem is on the employer side or the employee side?
Which side?
Well, my
Both
question,
sides. I think you're right. By the way, you phrased the question. I'll say that I agree with everything you're saying, including your last statement saying it was an employer and an employee issue. That's what I'm saying, is that I think that we need to take the time to talk to people, meet with people about what, many people know that they're going back into the workforce. They can't stay out of the workforce forever, right? So we're under, I think, 7,000 people that are on unemployment right now, well over almost 50,000 people who were collecting around Labor Day that are no longer collecting. So we know that there's going to be a connection, and I think it's a two-way street. We have to understand why the prospective workers, what's on their minds, and also we need to have the employees, the employers, listen to what's on the workforce's mind, and the businesses that are going to do well are the ones who answer the question that you just asked, right? Bringing back people gainfully employed in situations where they want to be employed. So, and there's multiple issues here. I think Secretary Walz spoke to it very well yesterday about a workforce that is looking to train up, so that they're training up to better paying jobs. Rhode Island's very fortunate. We were at New England Tech yesterday, and it's a long way to answer a very important question, so hopefully you bear with me here, is that we were at New England Tech. We met 3 individuals that have been working on an electric boat and welding for the last year plus, 2 women and 1 person that actually came from the self-employed area. And one of the women was from Woonsocket, and this is exactly what I'm talking about. We need to spend time in training up skill sets where people have the aptitude for those skill sets. And that 2 of the women that were there, one has 3 young kids, single mom, and she's earning a living to raise her family right now, where maybe before the pandemic, that wasn't the case. And then the one individual from Woonsocket, which was, I think lived in the country about the last 20 years, she's up to her pay scale significantly well. So the message that we're delivering to people who are waiting on the sidelines, look, if you're looking to advance your skill sets, we're willing to invest in those individuals, just like those 3 individuals that went through a training program that are now making a good living at Electric Boat. They're looking for 1,200 employees just this year alone. Fidelity's looking for 800 employees alone. When Amazon comes into the state in a year and a half, not only are the construction jobs going to employ 1,200 people at that facility, but they're going to employ 1,200 people in an income level that's going to get many people off the Medicaid. So I think it's the issue of this is the issue at the moment relative to the pandemic. If you're going to have a good economy, you've got to understand what is driving the individuals who are no longer in the employment, and what is the reasons why. Many of it could be very much mental health issues, social issues, up training issues, or potentially there are a number of people who have figured it out that they're going to raise their kids in a more 1970-ish way, right? That their families are going to be at home and they're going to figure that out. So until we understand that issue, and again, thanks for listening a little bit, because this is the most complicated issue that we're dealing with relative to increasing family income, and also at the same time keeping our economy strong so that Rhode Island keeps the lead. So that's why we're digging in. So is it appropriate to start off where we are right now? I think it is. We have about the $30 million that I identified that was meant to go back into the small business community that was appropriated but never allocated in 2020. We brought that in. We still have some dollars left. We think this is the most intelligent way to start to address this issue. But we have also put in our ask of the General Assembly for the federal recovery dollars to put a substantial amount of dollars into this effort in terms of what you're just talking about, in particular in childcare, right? Because we believe that we can reinforce up to 8,500 people in the childcare with the proposal that we put in. So very important issue, one that we really want to dig deep in. And anybody out there that's got some ideas, please share. I'll be at a Rhode Island 2030 presentation at CCRA in Warwick tonight, I think about 5 o'clock.
Well, I thank you very much for the very long and thoughtful answer, and I appreciate that. But on a short-term basis, I'm training and so on are a long-term, but on a short-term basis, one would expect the current economic situation on basic principles to try to solve the economic problem of unemployment by simply paying people more. And that doesn't seem to be happening. And I recognize and appreciate this is a very complicated question. But one would think that
I think the hourly rates are increasing. You can see it wherever you're going. And I've said this at this mic a few times, is that the hourly staff, the hourly rate staff are showing, are clearly showing that they're important to the business community and the nonprofit community, right? So there is a lot of pressure to raise hourly rates. I think that's going to continue, and also I think that there's people who are going to turn a lot of hourly rates into salary positions as well, because I think that, and so as I said, I think I stated that the companies who really understand the dynamics between the employer and the employee right now are going to benefit from that, and that's why this is the beginning of that process.
Thank you. We just have a few minutes left. Pat?
Governor, the MTX Corporation recently qualified for $3.5 million in qualified jobs tax credits for a mere 250 jobs over a 10-year period. Two-part question. Number one, isn't this constant need for deal-making, and I'm not faulting my good friend Secretary Pryor for that, but isn't that in fact a tacit admission as to the highly failed nature of our tax collection system? And B, this need for dozens of these catch-as-catch-can programs, while all worthy in concept, shouldn't the state of Rhode Island at some point just be attempting to reduce the cost of doing business here?
Well, I'm all in for reducing the cost of doing business. I've mentioned here at the mic a few times that we're preparing an article for this year's budget to talk about small business friendliness. And we intend to put that in. That's going to, drive a real strong message that Rhode Island is a good place to do business, and we're going to reflect that in that article. And again, anybody who has good ideas out there to talk about what belongs on that list for consideration, I'll balance it in the budget and I'll propose it to the General Assembly. So I'm aware that we need to make sure that we're addressing that issue. I'll let Stefan kind of detail some of the details on that issue.
I'm not
but
faulting the program per se. What I'm pointing out, though, is the need to have these constant negotiations for these type of programs reflects poorly on the method of tax collection. Shouldn't tax collection be simplified and modernized so that it's attractive for organic growth in business here?
So you're asking a question that would take an economist to answer. I'm not an economist. All I can tell you is that we're going to do everything we can to support the economy in the state and then the small business issues that we're going to put on this year's, in this article in this year's budgets. We'll address some of the issues you just talked about. But we can do it with both aggressive type of capture of a large company and a small company. We don't have to leave one at either end of the spectrum and say, oh, we can't do that one. So the value of that proposal, Stefan can do a sidebar on that one, when this is over. My feeling is that the economy is going to get driven by not only by working with small businesses, but also larger businesses and everything in between. And our methods of securing those, we need to be intelligent about it. And we're having some significant success right now relative to bringing in new companies, but at the same time supporting the companies that currently exist in the state.
We got time for 2 more questions. Yep. Governor, can you list some of the items that would be on that budget for businesses?
Yeah, so we're preparing a fairly long list, but the idea is where there's an unlevel playing field. I don't want to start specifically because I'm not sure that everyone's going to make the list. But wherever there's an unlevel playing field between a Rhode Island small business, a Rhode Island and a bordering state business, I think that we need to recognize those unlevel playing fields. If a certain, if something, again, whether it's on a tax or whether it's on a regulation or whether it's in a local community, we'll identify those issues. I'll tell you one specific one, which was definitely one that I'm going to put on the list, is that coming out of a pandemic, dealing with all the economic challenges we have, if a business is late with their tax payment, they get charged 18% interest on that late payment, and another 14% penalty on that late payment. We can't be a state that is dealing with usury rates and then expect that our business community is going to feel as though it's a friendly business environment, especially when we're coming out of a pandemic where I would expect that businesses are struggling. This is our point with the General Assembly. Let's not be slow on rolling some of these recovery dollars back into the economy in a way that makes sense, back into the housing that we asked for, child care. We can prevent many companies right now, small businesses, from either failing or rolling into a spot where they're paying usury rates for, and penalties. So those are the type of things we need to see what the bordering states are charging on those in that particular instance. And then we have a fairly lengthy list that we're assembling, and we're trying to ask people to bring in those lists. We've brought on somebody in Commerce that is dealing specifically with small businesses. That was one of our categories, equity, small business, education, and we've staffed up our office that way, and we're assembling that list right now. But that's one particular instance. We can't be charging 18% interest on penalties and 14% on penalties. Add that up. That's like 32%. Cost to a late payment. We're probably losing more tax revenue, as it was just explained, in terms of a collection strategy than we're actually gaining under that situation.
That is the interest on the payday loan, which is still legal in Rhode Island. I mean, it's about 30%.
Yeah, that's bad.
Not really usury, because usury would be illegal.
Yeah, I'm on board with that too. That should be gone.
All right. John?
Governor, 2 quick questions. The first one, yesterday you were at New England Tech with Secretary Walsh. I've been in that building. It's state-of-the-art. But it's also, New England Tech is private. It's very expensive. Tuition's $32,000. Why is it that Rhode Island doesn't have either CCRI or Rhode Island College, which is struggling, and URI? How come the state doesn't offer skilled labor technical training?
Yeah, so I think that's one of the reasons that I asked the secretary to come to the state, because he was talking about using community colleges in a way that you just described. I'm all in, I'm supportive of that. And one of the things I've asked him to consider is to look at Rhode Island College as being that college that if you go to that college, you graduate from Rhode Island College, you have a job. And so I think we're in the early stages of that discussion, and we have the opportunity right now to fund these programs, which was the three individuals I talked to you about earlier in terms of the job placement that they received going through there. It was primarily on electric boat type of job training. The next place that we went to, and I'm going to forget where I went, where did I go? The name of the job training place, which was
Building
unbelievable.
Futures.
Please?
Building Futures?
Yeah, Building Futures. So Building Futures was state-funded, federal-funded, along with which Secretary Walsh said that is the best labor training program that he's ever seen. And he said, I started one up in Boston, and I'm going to tell him about it. But practical point of view, they were drywalling, they were taping, they were bricklaying, they were using not only welding and multiple stages, which was a real first-hand job training. So yes, I am interested in the CCRI strategy with the Secretary Walsh. We expect to get him back here and talk about it and invest with us in the state. That's the reason I asked him to come with the administration's support. And Rhode Island College, I think that's a very interesting question you just asked, because I do believe that Rhode Island College needs a new branding strategy, and we need to take a look at where we need workers. I certainly would be favoring expanding the nursing school there at Rhode Island College based on everything that we've just witnessed and continue to witness. So I agree with what you're saying, and we are making that part of the agenda.
We're going to end with Patrick and Brian. Go ahead, Patrick.
Governor, do you support building a new bus hub in front of the Garrahy Courthouse, as has been discussed for several months?
Okay, so there's multiple plans there. I know that I've talked to virtually everybody involved. The last time I spoke to them was they got to come back with a plan that actually fits the budget and then gets buy-in. So I'm not sure exactly of the one you're talking about there. So
It has to fit the grant money, the amount of the grant money. It was $30 million roughly. It
I
has
think
to fit within
I
that.
just signed the bonding, I think for 30, I think in total it's like $35 million.
So it has to come in at that price for you to support it?
Unless somebody else wants to put up the money, but we've got 35 million.
But do you support it in concept, building something there?
Yes, I don't want to get specific on it. All I know is that we've asked them to come back with a plan that they can get buy-in, because everybody had a different idea what it would be. And I said at some point in time, I said, look, either we're going to spend that in Providence or we're going to spend it somewhere else. I believe that there has been progress, and the one you're talking about is the one that the last thing I was told about. I think that there's a way to shape that into the budget that's there, and it seems as though you got some pretty good buy-in from virtually every constituent base in Providence, which that's what I'm looking for.
All right, Brian?
Governor, following up on Bill's question, you're kind of pushing back on the whole idea of mandating these larger companies to have their employees vaccinated, as the federal government is doing. The experts seem to think, and the numbers seem to show, that when mandates are in place, the numbers jump up, as we've seen in the healthcare, to like 95%. What number are you satisfied with? If we're at 90% of adults right now, and you said we're not going to get to 100, what number is good for you when at some point we can move past everything that's happening now?
Well, we want to be the best in the country. Right now, we're the second best in the country in terms of vaccination rates, and we want to be the top for sure, and I think that we can get there. I don't think there's any particular number. I think when I said we'd get to 90%, a lot of eyes rolled, in Rhode Island. We got to 90% without mandates. You have to measure the value against the cost, right, in terms of that. Any company, and there are some that have put in mandates to work. Many of the trade unions have. So they have the ability to mandate right now, right? Any company has the ability. that's legal, and they can put that in right now. I'm just saying, let's work through the current mandate that we have in place right now, and let's work out the kinks, and let's learn from some of the things that we were talking about earlier in this conversation. Again, we got factors in there that we're the second highest vaccinated state in the country. We have the lowest death rates. Our hospitalization rates have stabilized. They didn't max out because of our vaccination rates. We're not a state that has 50% or less vaccinated adults in the population. So I think you got to balance it off. I think that the businesses that are operating in the state have been very responsible, and I think that they could call that. I think that they could make that call.
Did you express any, when Secretary Walsh was here yesterday, or did you express anything to him, or have you expressed anything to the White House about this and your concern
No,
with
I think
the
the
federal
first time I
mandate?
read about it, that it was coming this week, was sometime either before, during, or after that visit. So we didn't specifically talk about that. But I think I expect that I'm going to hear from a number of the business community. And again, I would think that you should be able to craft something that says states that are really have controlled the issue in terms of the vaccination, in terms of their infection rates, that they should be able to have some sort of flexibility in masking and testing.